WKYT Studios in Lexington, this is Kentucky Newsmakers with Bill Bryant.
Good morning from WKYT News. We hope you're enjoying your weekend. Later, with a new school year ready to roll, you'll meet the president of the Kentucky Community and Technical College System. Dr. Jay Box will be with us shortly. But first, the current president of the American Medical Association is an emergency room physician from right here in Kentucky. Dr. Stephen Stack started his tenure in June as the 170th president of the AMA and the youngest since 1854. Dr. Stack is holding the reins of America's largest group of physicians during a time of huge change in health care. The Affordable Care Act is still rolling out. Many are still calling for its demise, while others point out that it has drastically increased the number of Americans who have health care coverage. Technology is changing, patient care as well. Medical records are changing. The government and health care are intertwined like never before. And it's also an interesting fact that Dr. Stack isn't the first Lexington physician to serve as AMA president. Dr. Artis Hoven held that highly respected position a few years ago. AMA President Dr. Stack with us this morning. Welcome. We appreciate you coming in.
Good morning, Bill.
Well, you've told us you're 42 years old. It's quite an honor to be selected to lead this national, international organization. How did it happen that you were chosen to lead the AMA? What steps did you take to get there?
Well, it's a point on a journey, and so it began 20 years ago for me in 1995 when, as a medical student, I went to my first AMA meeting in Washington, D.C. And as they say, one thing led to the next, and here I am 20 years later serving as the president. It's a great privilege and honor. You have always been interested then in issues outside just what's going on in the patient care room. Well, I have the great privilege of helping one patient at a time and can have a profound impact on people's lives and well-being. But if we want to bring that to scale and help more people on a larger realm, then you have to be involved with others in order to bring bigger visions to bear, and so I like that. And so how do you see your role in leading this large group of physicians into the future of health care? Right, so we have the opportunity to do some really big and bold things, and so at the AMA we are going to change medical education in a way that is as profound as we did over 100 years ago. We're going to find ways to support physicians to have fulfilling and successful medical practices in support of patients, and we're going to find ways to help prevent people from becoming diabetic and help them keep their hypertension under control so they can lead healthier, happier lives. To do things on that scale and that size requires the efforts and the resources of a large organization with the respect of a lot of other stakeholders, and the AMA provides that opportunity. Let's talk about medical education. You're talking about drastically changing it. What would you like to see happen? Well, so the current structure that physicians use for their education is 2 years of basic sciences and 2 years of clinical sciences. The content has changed because science has evolved. We're at a point in time now where the care team has evolved quite a bit. There are nurse practitioners, physician assistants, pharmacists with advanced degrees, and many others. We need to find ways to train physicians to work within a team-based care model, and we also need to find ways to provide them with the knowledge and skills to thrive in a world where the regulatory complexities are enormous, the legal and compliance issues are staggering, where they have to work with a much larger team and lead from within the team, not just above the team, and also find ways to reduce healthcare disparities, lower costs while improving quality. It's a very different assignment than the physician had a century ago, and we're going to work to change now not only the content of the education, but also to change the structure and the tools we use both to teach and assess the competency of those physicians. Is it a good change in your view that we have moved away from, you know, the doctor who maybe runs his own office and hires and pays his own staff and this sort of thing, and takes whatever's left over as his salary, to where we are now where so many physicians are employed by, in many cases, large corporations that employ hundreds of doctors? Right, so I think we're in a period of change and evolution. I don't think that old model is deceased, and I don't think it'll become extinct. I think there'll always be a need and a place for small physician offices and very personalized interaction with patients. There are some benefits to the integration of physicians with a larger health system where you can have efficiency, you can have consistency over time, hopefully improve quality and safety. But those have to be counterbalanced by the need to empower physicians to be able to still be advocates for their patients and tailor care to the individual patient.
As an advocacy group, how is the American Medical Association watching the implementation of the Affordable Care Act or Obamacare?
So we've been an active participant from the beginning. It's long established that people without health insurance live sicker and die younger. And so the AMA has had qualified support for the Affordable Care Act from the beginning, but we continue to work to improve things within it that need to be improved. I would say at the highest level, though, having tens of millions of Americans with the possibility of having access to health insurance to enable them to have preventive care and maintenance care will enable a lot more Americans to live healthier, happier lives, and we think that's a very good thing.
What are some of these tweaks that you think may become necessary?
Right, so we need to work to make sure that the Medicaid platform, that program compensates the health providers appropriately so that they can have the resources they need to provide quality care for Medicaid patients. We need to make sure that the health insurance exchange not only makes health insurance affordable as a product, but also provides a benefits package that makes it affordable for them to access care. We also need to make sure that this is deployed across the entire nation. There are a number of states who have chosen not to expand Medicaid or to not create health insurance exchanges. And in those states, their population runs the risk of falling behind because they don't have access to health care, whereas in Kentucky, both Medicaid and the insurance exchange were set up here. And this is one area where Kentucky is arguably at the vanguard of trying to make things better for patients.
Has that given you an opportunity to communicate Kentucky's experience to other states?
Yeah, as a Kentucky physician, of course, I share the experiences. I live here, and as an emergency physician practicing here in Lexington, I see it. Patients that I take care of now have the ability to get prescriptions filled, whereas before they may not have been able to afford it. They have the opportunity to seek follow-up care in an office, whereas before that may have been unattainable. So I do see improvements, and I do see a brighter future ahead for Kentuckians as we continue to navigate these changes. You
talked about you are an emergency room physician. Of course, we all have our image of that as a very dramatic scenario a lot of the time. But you said in many cases people are walking in with underlying health issues, problems that are already going on that may have led them to that point.
Right, so this brings us to some of the work the AMA is doing. Pre-diabetics in the United States are about 86 million Americans, 9 out of 10 who do not even know they're diabetic. There are about 70 million hypertensives, many of whom are not identified or properly treated. Here's an instance where if we intervene early, prevent people from becoming diabetic in the first place, and treat their hypertension, they can avoid heart attacks, strokes, vision loss, kidney failure, all sorts of serious problems. And those are the points where I often see them in the emergency department when the complications have occurred and we can't fix things nearly as well. So the AMA is working with partners like the CDC, YMCA of America, Johns Hopkins to try to put in place programs to help more Americans avoid these very common and terrible diseases. How early is early in preventing, say, diabetes? Isn't it good to try to get children on the right path right off the start? Well, sure. So it's a simple recipe, really. It's eat better, eat less, and be more active. But how difficult that is for most people to do. It needs to start in childhood, but we know that when we do a program with the YMCA of America, we can take even a 60-year-old, and if they comply with their diabetes prevention program for the course of a year, we have a 7 out of 10 chance to prevent them from becoming diabetic. That's phenomenal. So at any age, it's never too late to start. But you're absolutely correct. Starting in childhood yields the best long-term benefit. We know we have other preventables in Kentucky, and one of those is a high rate of smoking, one of the highest in the nation. A state law has been proposed that would ban smoking in indoor public places. It last year passed the state house. It has never made it to the governor's office. Do you think that will change going forward? Is the AMA involved in that? Well, we hope that Kentucky will join others who have passed bans on smoking in public spaces and workplaces. There is no safe dose or level of exposure for secondhand tobacco smoke, and we think it's really important in order to prevent people from the risks of cancer and lung disease and other conditions to ensure that both smokers hopefully stop smoking and that non-smokers are not secondarily exposed to these things. So I don't predict the political world anymore. It's My crystal ball is cloudy, but I would say that we're certainly hopeful that Kentucky can join other states and pass that statewide smoke ban.
What are some other ways we could significantly improve our healthcare landscape in Kentucky by just making some simple changes?
Well, one thing, I think we need to have a partnership between the state government and the medical profession to continue to look for collaborative and positive ways to reduce the opioid epidemic that we have. So daily in the news we hear about heroin overdoses and overdoses with prescription pain pills. The AMA is working with a large group of medical professional societies and other stakeholders to put in place educational tools for physicians, drug monitoring programs for patients and tools for physicians, and a number of other things such as first responder access to naloxone to help save people who've had overdoses. And so we think working in partnership and collaboration with the state governments, specifically Kentucky in this instance, we have an opportunity to make a big positive difference for the health of a lot of people.
You have dealt very firsthand with those situations where people have come in an overdose situation.
Unfortunately, I have.
And what is that like? I mean, that's a matter of seconds counting, right?
Well, it is. So the brain starts to suffer irreparable damage with just 4 minutes without blood flow or oxygen. And one of the side effects of opioids is to stop your breathing. And so someone who doesn't receive prompt medical attention can literally suffer permanent brain damage or death within a very short time. It's a tragedy. I've seen mothers with their young children come in, the child having to see their parents in that condition, the parents having to see their child observe them in that condition. In many other situations, it's really tragic. It is truly a situation where many people are victimized and suffer bad consequences, and so we have to find a way to make that better.
Dr. Stack, some have worried that the Affordable Care Act puts in place a network of rules as well that might impinge on the physician-patient relationship, that makes doctors make decisions that are what the government or an insurance company would have them do. Even over the area of managed care, where the charge has been that accountants are making the decisions rather than the doctors. Do you feel that at times?
Well, I think we have a challenge in society in general with excessive regulation and the need to reduce red tape and regulation so that industry can innovate and provide better services to patients, in this instance, other customers. We've had challenges, as you mentioned, though, with large private insurers putting in place rules and requirements that interfere with patient care and physician advocacy for their patients. With the proposed mergers for the largest private health insurers in the United States, we have concern that those would be even bigger problems for patients and for their doctors who serve them. So you raise a valid point. There is a need to ensure that the doctor-patient relationship remains at the center of all health care, and that a physician and their patient can work together in partnership to do the best possible care and make the right choices for that specific patient.
As Kentucky approaches the time when we'll have to assume more of the cost of the Medicaid expansion, some bells are going off about the potential cost of that. What would you say to that? If the cost does go up, does Kentucky simply need to dig deeper into the pockets of taxpayers, or will this, as Governor Beshear has said, in the long term pay for itself?
Well, I think that's misunderstood often. The federal government in perpetuity has proposed to pay 90 cents of every dollar, and that's phased in. So in the long haul, if you had to spend 10 cents, you had to spend a dime to get 90 cents. That's a pretty good return on investment. So in terms of the health of Kentuckians, their productivity and the workforce, the economic stimulus for the state, spending a dime to get 90 cents is a good investment over the long term. And so yes, the price will go up slightly, but the return on that is a ninefold return. And I would suggest, in terms of having healthier Kentuckians who can be more productive and happy with their families and do better work, is a long-term, a far better investment for the state.
Well, you have a busy several months ahead as president of the AMA. We want to thank you very much for coming in.
Thank you,
Bill.
Bill.
It's an honor to have you.
It's nice to meet you.
We'll be back in just a moment on WKYT. We'll meet the president of KCTCS and talk about the new year ahead and job training in the Commonwealth. Next on WKYT. Welcome back to Kentucky Newsmakers from WKYT News. Kentucky's Community and Technical College System, KCTCS, is a system of 16 colleges and more than 70 locations across the Commonwealth. In the most recent academic year, 43% of the state's bachelor degree graduates previously attended a two-year college. The Shaping Our Appalachian Region, or SOAR initiative, has a strong partnership with KCTCS right now, which also trains 80% of the state's firefighters. That's one example of what they do. Joining us today is Dr. Jay Box. He is the president of KCTCS, and he came to the job after years within the system, including serving as president of Hazard Community College. Dr. Box, honored to have you. Thanks for coming.
Thank you, Bill.
Appreciate it. Give us an idea of the scope of KCTCS and its reach within the Commonwealth.
Well, on an average year, we will have about 127,000 students who come to us seeking degrees, and we're very thrilled to have that input. Almost half of all higher education students start their education with KCTCS.
So it is an important gateway to opportunity.
Yes, both on the transfer to the universities, as you mentioned, and also the career pathways on into the workforce.
You've managed to keep costs at less than half of the four-year colleges in the state. Is that something that you can continue to do with current levels of support from the state?
Well, that is a point of contention that since 2008, our budgets have been cut by the state by $38.8 million, and that's a huge amount of money. When you also consider on an annual basis, we have about $5 million of fixed cost increases. So it is getting more difficult, and we've had to raise tuition some during this time, but this year we chose to freeze tuition because we just don't believe it's right to continue to put the cost of higher education on the backs of our students.
How do you make up the difference?
Well, we've had to do some budget cuts. We've had to cut about another $32 million out of our budgets this year, and we're tightening our belts, but we're hoping that that makes a difference for students because we're in this business for the students. But we really are going to have to work with the legislature and convince them that it's time to reinvest in higher education in Kentucky.
Give us some idea of the realm of options that students have within KCTS, some of the programs that you have. What are some of the emerging and growing programs?
Well, you mentioned SOAR, and that initiative in Eastern Kentucky has some very futuristic type of careers that they're expecting in Eastern Kentucky. One is coding degrees to deal with the computer information technology degrees where they'll focus on coding in the newest programming languages. That's going to be a high need. Another area, as we implement this high speed internet across the entire state, but especially in Eastern Kentucky, is the need for fiber optic people, especially in the splicing industry where they splice and install the cable, and we've got one of our colleges that's already started a program in that.
How dedicated are you to lifelong learning? How many of your students are non-traditional students who've kind of realized that they need to continue to get more training and education? Yeah,
the average age of our students is about 27, and so we've always had a major interest and focus on the non-traditional or older student. We still have about more than 50% of our students are between 18 and 22 years of age, but we do have a high population of adult students.
You've said about roughly half of those then are going on to college to get a four-year degree, or they're going on to further study. Of those who are getting a certification or a degree from one of your institutions, what typically are they going into?
Probably the biggest area that we train and educate students for is the healthcare industry. Nurses, physical therapist assistants, lab workers, things of that nature.
Can you train them fast enough? We hear that, we talked in our earlier interview about the implementation of the Affordable Care Act. There are more people with coverage. There is more need for personnel, right?
Right. Some of the programs, a nursing program in particular, might take 2.5 years to complete that program, but many of our other programs are a year-long program and can put the graduates right into the workforce.
How important is the idea, of course the original name was the community college system, that those campuses be located close to people so that they are not having to make a tremendous trip or having to move to a residential campus? I mean, is that sometimes the deal maker that gets people to get into college?
Well, it is, and you mentioned that we're now 16 colleges and more than 70 campuses across the Commonwealth, and that's important. We have a campus location within a 30-minute drive of 95% of the population, and that access is critical. Since we were formed back in 1998, we've more than doubled the access to students, and that's been because we have built facilities in communities that provide that access.
It was the 1997 Act going into 98 that made those changes. Do you think in the long run it has proven wise to create this separate system that is an entity that came from being underneath the University of Kentucky umbrella?
Yes, absolutely. When we recently had a study done by the NCHEMS organization, and they compared us to other community college systems across the nation. And since we were formed, and from the last 10 to 15 years, we have now jumped to the #2 system in the nation for providing access, the #4 institution in the nation for providing credentials. So we think we've made a huge difference.
Do you teach online courses?
Yes, we do. We're the largest provider of online training in the state. We really have been a national leader in this area. Our competency-based program, Learn on Demand, has gotten many national awards and is recognized as one of the most innovative ways to deliver online learning in the United States.
I want to take a break. When we come back, I want to talk about how you decide what you're going to teach, what employers tell you about what they need workers to know. We're coming back in just a moment with Dr. Jay Box of the KCTS Community College System here in Kentucky. In just a moment. Welcome back into WKYT's Kentucky Newsmakers as we visit with Dr. Jay Box, who heads up the Community and Technical College System in Kentucky. And I'm curious about this. We say in Kentucky that we often have a mismatch between what the employers need and what employees are trained to do, potential workers are trained to do. How do you attempt to work at that?
Well, it starts in two different ways. One way is for the involvement of the local college president and myself with the CEOs of business and industry across the Commonwealth, where we talk with them and get feedback from them. Another way we do that is through our advisory committees. Every single one of our occupational technical programs must have an advisory committee that consists of representatives from business and industry. They give feedback on the curriculum needs and the demand of workers, so they'll know how many graduates that need to be turned out. And that loop helps us very much in preparing the workforce for the future. Do
companies tell you specifically, exactly the kind of courses they need you to teach?
Well, that's happening a little bit more than it used to. Now we're seeing that since the recession, most of the jobs have begun to change, and as more automation and more computer usage has been taking place. So they've been more straightforward with us with the need for us to change our curriculum, and so we're very much revamping a lot of the things we do to meet their needs.
Do they demand that people be simply good communicators these days?
Well, that's one of the issues that we're hearing more and more, is that our graduates are coming out with not having the soft skills or employability skills that they'd like to see. So this year in particular, we're revamping our curriculum across the state to put more emphasis on those areas.
And how responsive are you to students? You've just concluded an assessment, and the students themselves gave their opinions about where the system should be headed.
That's correct. When I took over in January, one of the first things I wanted to do was put out a survey to students and to community members to get their feedback on where we should be going as an institution. And the students were very responsive. What they're most concerned about is job placement after they graduate. So we're now trying to address that and do a little bit more on career placement, job placement, from the very beginning, from the time they step in our doors all the way until they're employed.
Dr. Box, what would you say to a student who may be bright, has all kinds of abilities, and yet they question the financial assistance they might be able to get? They may not really have a direction as to what it is they want to study. What do you say to a potential incoming student like that?
Well, the first thing I would tell them is that we're the most affordable institution in the state. They can, if they're going on to a bachelor's degree, they can reduce their cost for that bachelor's degree by half. And that's very important in today's tight money times. The other thing I would tell them is that we do a great deal of what we call our first year experience, where we're helping students discover where they want to go. And that would help them if they're still floating out there, they really don't know what their future career will be. We do provide that opportunity for them to explore.
And then the financial piece?
Financial piece, with financial aid that's available, that pays for about 90% of our students are on some type of financial aid. And so there's plenty of both federal money, state money, and scholarships that are available for students.
And you'll be going to the legislature shortly with some other wants and needs, right?
That's correct.
All right. Thank you for coming. We appreciate it.
You bet.
Dr. Jay Box, who is president of the Kentucky Technical and College System here in Kentucky. Thank you for being with us, Community College System. Appreciate you joining us here on WKYT for Kentucky Newsmakers. I'll see you bright and early this week on WKYT This Morning, and we hope you make it a good week ahead.